So good afternoon, everybody, and thank you for coming to our first weekly Nevada County vaccine status update. We are lucky we are joined by the three luminaries that are responsible for all to get everything done. So we have Dr. Scott Kellerman, the Nevada County Public Health Officer. We have Ryan Gruber, the Director of Nevada County Health and Human Services. And we have Jill Blake, our Nevada County Public Health Director. So the goal of this is to provide Nevada County residents updates on where we're at, how many vaccines do we have, who can get vaccinated, and if you can get vaccinated, where do you sign up, and whatever else we have. And also a short update on where we are with COVID cases in Nevada County, and are we looking good? Are we looking better than a week ago, 2 weeks ago? So I think, Ryan, you got some numbers for us.
Yeah, so, and I would encourage people as usual to go out to the dashboard where you can see the numbers updated on a daily basis. First of all, Pascal, thanks for having us and helping facilitate access to information for the your viewers. In terms of COVID cases, we're currently at 3,577. We're still at an extraordinary number of active cases, around 560, which means that our communicable disease team and our contact tracers and investigators are really doing amazing work to try to contain the virus at the same time as our health department moves strongly into vaccinating the community as well. So a big shout out to Jill and her team for managing that. In terms of the trends, we are starting to see a gradual improvement compared to where we were in December. There's still a significant number of new cases. If you go out to our dashboard, you'll see we're averaging probably in the 20 to 25 range each day recently. We saw a slight uptick in terms of the state's tiered framework this week, but with the way things are trending, hopefully we'll continue in a way that's going to start to come down as well, and we'll start to get to those tiers that are more permissive in terms of business activities. You asked about testing, I think, as well. Testing, we want to remind people testing is available and accessible through LHI and our website. We have the OptumServe site up and running in downtown Grass Valley, as well as a site that is at Tahoe Forest Hospital in Truckee, and demand has really subsided. So I want to remind people that tests are available, and it's still very important to get tested.
And they are free.
And they're free, yeah. So that's it for me for the general update.
And Jill, do you have numbers for us about the number of vaccine doses, or Dr. Kellerman, who has those numbers of how many doses does Nevada County have? And when we are talking doses, are we talking one dose, or is that the 2 doses that people need to get?
So I can share the numbers with you. And again, thank you, Pascal, for having us. It's good to have an opportunity to get good information out there. So last week we reported that Nevada County, through our health department, we can receive vaccine, and we can also allocate vaccine to community partners. And people who tuned into your town hall last week saw Ryan do that presentation where he illustrated, I think, really clearly just how vaccine comes into the community. So the vaccine that has come in through our department, and again out to healthcare providers as well, as of this week, we should have received 10,625 doses. And then this week, we know we have an allocation of just over 2,000 more, and those doses will be delivered next week. So next week, we should be around 12,700 doses that coming into Nevada County. And that includes both first and second doses.
That's important, because we got several questions from people who were actually eligible to get the first dose, but wouldn't. Well, I'm afraid I can't get the second dose on time. So those doses, that's the complete set.
Yes, and I will say that we have a terrific vaccine coordinator who manages that vaccine and makes sure that we're getting those second doses to those providers. And then they as well are experienced vaccine inventory managers. So we're working to make sure that people get both their first and second dose.
And we're going to have a question about which vaccines are available. And I believe that's both Pfizer and Moderna.
Correct.
That's true.
So who can get vaccinated right now in Nevada County?
So right now, all healthcare workers are eligible to get vaccinated. We're still working with some folks and getting people in, sort of the stragglers. And on our website, we actually have a form so that if you're a healthcare provider and you have not received outreach or received your vaccine, you can go ahead and fill that out. But we're also firmly moving into phase 1B. And phase 1B, just to be clear, as I've said in other forums, there's not enough vaccine to get to the 30,000 plus people who are in that phase at this point. So we need to temper expectations a little bit. And according to state guidance, in situations where that supply is limited, the priorities are people over 75, teachers, emergency services, and food and agriculture. And we are, through our providers, in very limited supply, starting to work through people 75 and older, rather than just throwing vaccines out there 500 at a time and rewarding the people who can refresh their browsers the quickest or have the best internet connections. We are trying to target those and work with providers to outreach to those they know are the most vulnerable. Then we're working through teachers as well. Last week we did Western Nevada County, and this week we partnered with Tahoe Forest Hospital and the schools to do the Tahoe Truckee Unified School District. And then we're also working with providers on emergency services as well. Food and agriculture, the other eligible sector. Statewide, counties are awaiting clarity on what exactly that means. And we'll be getting there soon. So anything to add to that, Jill or Dr. Kellerman?
I mean, we tend to, thanks for having us, Pascal. We tend to focus on vaccines, and of course that's appropriate because everybody wants to get immunized and achieve herd immunity in our county. But as Ryan originally began this conversation, we're still looking at close to 25 per 100,000 residents, new cases daily, which still keeps us in the surge and in the purple zone. And so I'd encourage people, we got football Sunday coming up, Super Bowl Sunday, and please, we're in the middle of a surge. Very few people in this county have been immunized so far. So practice appropriate restrictions. Don't gather when you have any meeting at all. Make sure you wear a mask, wash your hands, and social distancing. And because in order to get into the red zone, appropriate for Super Bowl Sunday, it's we have to get below 7 per 100,000, and we're currently around 25 per 100,000. So we have a ways to go before we can open up this county. So, the non-pharmaceutical approaches are certainly appropriate besides immunizations.
And of course that includes not mixing households, but also the frequent hand washing, the wearing the mask, and just and keep your distance. And for Super Bowl Sunday, I think instead of having everybody over, you can always get into a contest with your neighbors who can yell the loudest or applaud the loudest. I mean, that's one way of doing it. It's not quite the same, but if actually we get this down to below 7 to get into the red tier, or even if it's really, we really should take a leaf out of Sierra County, because I believe they are basically the only one that's like in orange right now. That's one of the only counties that's actually, so of course fewer people, fewer cases, but so keep your distance, wear your mask, wash your hands, and Super Bowl is going to be it's going to be, watch it on TV, and you can have your tablet or whatever and watch it with the friends and family you would normally do. But back to the information. If you are in one of the categories that are eligible for vaccination now, where do people go to sign up? And if we can separate it. We got quite a few questions from the east side about people that would like to either sign up, and also asking if they can go to, for example, Placer County, because there was some availability in Placer County. So where do you sign up if you are eligible to get the vaccine now?
So I'm happy to jump in and say, as Ryan mentioned, there's a form on our website. If somebody's a healthcare provider and they haven't yet been contacted by us, they should fill that out. And if they're eligible, we will direct them to a healthcare provider. So please, by all means, do that. For those that are eligible, such as the emergency service workers and education, again, we're working closely with those groups to make sure that they get assigned to a healthcare provider, or we partnered with the schools and with the hospital, as Ryan mentioned, to hold these clinics specifically for educators. For everyone else, we want to recommend that they sign up at for MyTurn. That's myturn.ca.gov. And that is a system where, just like it sounds, when it's your turn, you'll get a notification. Nevada County, we're really fortunate. We got our name at the top of the list, and we're one of the first, we're in the first wave of health departments that are being onboarded into that system. And so when that is active and when we're able to populate that system for clinics, that's where people can hear about them. So I think those are probably the best resources at this point. And then just keep checking our vaccine webpage, because there will be information updates there as well. And if there is another mechanism for people to do, to find out where they can get vaccinated, we'll make sure that they can find out there. I will add one more thing, Pascal, and that is that there, as Ryan indicated, there are some healthcare providers that are vaccinating their patients. They're using the age criteria. They're looking at who their most vulnerable patients might be vulnerable to that, to COVID-19. And so if you hear from your physician, by all means, return that call and get the vaccination. In terms of can people go to Placer County, honestly, in Nevada County, we're asking our healthcare providers to check to make sure that those who are in an age category are indeed residents of Nevada County. For people who are in professional sectors, they get vaccinated based on the county where they work. So in terms of can they get vaccinated in Placer County, I'm not sure of the answer to that. I'm not sure if they're checking residency as well.
Yeah, and MyTurn, if you sign up for MyTurn, and if you want to get confirmation via cell phone at some point, you will actually get a registration confirmed. Hello, thank you for recently registering at myturn.ca.gov for updates on COVID-19 vaccinations in California. You will be notified when it's your turn to schedule an appointment for a vaccine. And then for the latest information, you can also visit vaccinateall58.com. And that is for if you have a cell phone and you register with myturn.ca.gov, which again, and congrats for Nevada County to be first on the list there, in the top of the list, because when the system was available, it was basically just the beta testing for San Diego, and then they said, yeah, you can sign up. But once it was open, all of a sudden, then that's when I get the confirmation saying, yes, there is. And then we have, of course, this being Nevada County, not everybody has, let's call it reliable or even existing internet. So we have questioned, are there any organizations that help people without internet or that have difficulties accessing the internet to sign up with MyTurn? Is that where 211 comes in?
We've definitely talked about partnering with 211. We haven't reached a formal agreement yet because we're not at a place yet where we're opening up broad clinics, because we simply don't have enough vaccine to do that yet. But there is a toll-free number for MyTurn as well. People can call and talk to an operator and get registered in MyTurn. But that concern that is expressed about not having reliable internet, or even just people who don't have the right technology, that is a big concern that has been expressed to the state, and we're all talking about what alternatives might look like. Within our department, we are kicking off efforts both in Eastern and Western County to start conducting outreach to more marginalized populations. Outreach and education is one thing, but getting people signed up for vaccine appointments is another. So that's something that we're tackling right now, but we don't have a perfect answer to yet, but it's definitely on our radar and something that we're working towards. And
the one question that is popping up a lot is that, well, some of the healthcare systems like UCD and so on, they are making appointments for people over 65. And how come they are doing it and that the county isn't? And I think that's simply vaccine availability.
It is, and the difference is in Sacramento County, 14% of their population is over the age of 65. We're 30%, over twice as much. So it's a much heavier lift in our county with respect to folks over 65. So we're targeting 75 plus initially, and then we'll be moving down into the 65 plus age group. And as Jill and Ryan mentioned, it's all a partnership. We're working with the FQHCs and providers and Docomo's pharmacy and how we can get this vaccine out to as many people as promptly as possible. But kind of the bottleneck now is lack of vaccine. We're hoping that'll change, though, Pascal. That's all the difference in the world.
Mhm.
If we have vaccine, we can immunize.
And I'll throw out there that a system like Sutter, they are considered a multi-county entity, and they are getting vaccine directly from the state to vaccinate their patients. So again, that's one mechanism the state is using to get vaccine out. So when you have those larger healthcare systems, you will see that playing out.
And also a lot of questions for people who do not have a local healthcare provider, how they will be informed, how do they sign up? And again, I think that's where the myturn.ca.gov comes in. And another question is, there were some statistics that our colleagues in the union published. It will take until mid-May for all those over 75 to receive their vaccination. That estimate is probably not accurate, because if there are more doses coming in, and you will accelerate, of course, and I think that's what the governor calls the flywheel that's turning. So that there is more. There's more vaccine coming, so it will not take until mid-May to vaccinate everybody over 75. Fingers crossed. Another question being, are you working with all providers in the county? Are you communicating with all the doctors? Is public health communicating with all the doctors to target recipients over 75?
Well, basically, the answer is yes. We're working with all providers. Not all providers have signed up with CalVax to accept immunizations so far. There's a little training and IT that they have to be more familiar with, and reporting. So not all providers in this county are able to immunize. I think that's going to start changing, no, Pascal. I think it's the best outreach in this community is if you have a physician or physician's assistant or nurse practitioner to call you and answer your particular problems. We look at the county as a safety net. We take care of those without insurance and the ones that are marginalized. That's our role. And the second role I see is being a coordinator with these other entities so that they can reach out and do the heavy work that needs to be done, particularly with their own patients.
And the system, so the Dignity Social Memorial, Tahoe Forest, they are getting, since they're getting a lot of the allocations directly from the state. Do you supplement some of the allocations if available? Do you, for example, do you give them doses? And also, is, for example, Tahoe Forest, is Tahoe Forest getting vaccine from just from the state, or from Placer and Nevada County as well?
So I can share that the only multi-county entity in our county is Common Spirit or Dignity Health. So they are getting vaccine directly from the state, and they too are getting vaccine to vaccinate their patient population and their staff. Tahoe Forest is not a multi-county entity. They are a hospital that serves multiple counties, but to be an MCE, you have to actually have facilities in different counties. So we are allocating vaccine to Tahoe Forest. I believe Placer County has also allocated some vaccine to Tahoe Forest Hospital as well, because we understand that up there, even though we recognize those county lines, the community doesn't necessarily. So Tahoe Forest has been a great vaccinator in the Eastern County, and so both health departments have allocated vaccine to them.
Mm-hmm. And we have somebody who's really, really insisting on getting an estimate of when all people over 75 in Nevada County will be vaccinated. So if somebody wants to give a rough estimate.
As soon as possible.
So what I will say is, and I don't know if this was covered, I apologize if this is a duplicate, but a silver lining or a light on the horizon is that the state is updating the vaccine allocation methodology to account for % of the population that's over 65. And that will play pretty dramatically in our favor, or hopefully dramatically in our favor, because we represent about 25% of the state's total population, or sorry, 0.25% of the state's total population, but 0.46% of the population over 65. And so we should be getting more vaccine as a result of the transition to age-based. And so it's hard to predict without knowing how much supply is coming down from the federal government, what that will look like, but it should start looking better.
Yeah, that did start 2 weeks ago. So we've already seen a slight uptick, and that will increase for the next few weeks. But like Ryan said, if the state doesn't get more vaccine, they can't give more to us. So it's difficult to predict.
And what is the approximate turnaround time after somebody fills out the Tier 1A form? Because there's specifically for parents who are considered caregivers to children with disabilities.
I think they're hearing back from folks pretty quickly. We have an analyst who's working on that list on a daily basis. So so they should get if they meet the criteria, they should get a pretty quick referral to a healthcare provider. And then it might take a little while to get on their books to get the appointment scheduled, but it should be relatively quick. And
a question about emergency personnel. So do licensed mental health providers, therapists, etc., do they qualify for as healthcare workers? And are mobile service technicians considered emergency personnel?
So mental health and behavioral health providers are definitely considered healthcare workers, so they qualify under Phase 1A. I will say just a qualifier that right now the vaccine is being prioritized according to workplace exposure. So if somebody is working remotely and plans to do so, they wouldn't necessarily qualify for the vaccine right now. But again, it's based on workplace exposure. So behavioral health and mental health providers fall into the healthcare provider Phase 1A. So please fill out the form if you haven't heard from us. And what was the second one, Pascal?
Mobile service technicians.
I'm not sure what that is. Sorry.
I would assume mobile service technicians are people. I would believe that well, plumbers, etc., would fall under that.
So I'll tell you right now, the way it's been defined, it does include fire, law, and corrections. And beyond that, we haven't had any other clear definitions from the state as to who else might qualify for that category. We've had a lot of questions from people about whether or not they qualify, and we rely on the state to provide clarification. And to date, that's what we've gotten: fire, law, and corrections. And
also a question about the volunteers for our various for the food bank, etc. Are they considered healthcare providers, or do they fall within the 1A tier?
Volunteers at a food distribution site?
Yeah.
Is that the question? My guess is they're probably going to fall under food and ag. But again, we're still waiting for a clear definition from the state on who that includes. We anticipate it will include grocery store clerks, restaurant personnel, and my guess is that's where they'll fall as well.
And going back to Truckee, will Truckee pharmacies get the vaccines, and doctors, will they, that are not affiliated with Tower Forest, will they get vaccine doses?
There's not Safeway immunizing right now in Truckee. And the individual doctors need to apply if they're associated with Tower Forest, yes, but otherwise the docs need to sign up with CalVax, just like the docs in this side of the county, in Western Nevada County.
And childcare providers, because an important group for a lot of people. So where do they fall in these categories?
They fall into Tier 1 of Phase 1B. So where we are right now, it's education and childcare. So education and childcare, emergency services, food and ag, and 75 and older. So we have not scheduled things for childcare providers yet. Again, we just don't have enough vaccine to vaccinate everyone, but we are receiving information from people who have that correlated information about childcare providers, so we can start planning for that sector.
Mm-hmm. And of course, there are a lot of remarks about people over 65 that have in other counties that have gotten vaccines. But again, it is probably due to the small allocation that so far. But like you said, Jill, there is more coming, and that should now go up substantially. And I think then we'll have to thank all the seniors in Nevada County for getting a larger vaccine allocation. Because and then Ryan, it's really interesting that Nevada County, if we are 4.6% of the senior population of the state, that's pretty impressive.
0.46% of the
0.46.
population.
Oh, okay.
Which is a lot more than 0.25, which is our general percentage of the population, but not 4.6, no.
Yeah. So just we are approaching the end of this. I really want to be respectful of your time. Keep this to 30 minutes because we're going to do this every week. So people over 75, healthcare, everybody who is in tier 1A, and on the county website, on mynevadacounty.com, that is where you can find the form where you can sign up, and then the website. Also today, you updated the website with the message for the Safe Super Bowl, and I think it would be it's a good way to remind people that yes, please be careful. Don't congregate with people out of your household, and just be safe. Takeaways for this week, Dr. Kellerman.
Be wise, immunize. It's real simple.
Ryan?
Takeaways, we're firmly into 1B, and we will be vaccinating and reach out to more and more. And there's great change coming with the My Turn system, so people now have that single point of registration.
Jill, you get the last word.
I would just like to thank our community for all they've done to contribute to our decreasing caseload, and to say keep up the good work. We can get out of this if we're taking responsibility for ourselves and those around us. So thanks for all that everyone has done, and I encourage you to keep on with what you're doing.
All right, with that, thank you very much, and let's do this again next week. And everybody, please stay safe and enjoy your weekend. Bye.
Thanks, Pascal.
Bye.